Hello and good morning everyone. This is Dr. Prashanth B.R.K, Consultant Orthopaedic Surgeon, Sree Manju Hospital. So today I am going to talk about a very important topic called synovitis. So this synovitis is very often seen in multiple joints, but knee joint is the most commonly affected joint with synovitis. So what is the synovitis and when does this happen? So synovitis is nothing but inflammation of the synovial tissue. So normally our knee joint is covered with the synovial tissue. The synovial tissue is a membrane which wraps the knee joint and produces the synovial fluid. So the synovial fluid is nothing but a lubricant. In a normal layman term, the lubricant which is required for the knee joint smooth functioning is produced by the synovial membrane. So in some cases or instances when we have some minor injuries, in some of the individuals they are susceptible to producing more synovial fluid. So it's a natural defense mechanism of the body to produce excess synovial fluid to protect the joint. So in such cases, normally there is around 4 to 6 ml of synovial fluid in the knee joint. But when there is a very small injury, in some instances, in some individuals, the body can produce up to 50 ml or 100 ml of synovial fluid. So this synovial fluid makes the joint very tight and tense, which causes lot of pain because of stretching of the tissues. The patients will have difficulty in walking and folding their knees. That is when they approach the hospital for further treatment. So in such cases, if the inflammation or swelling is very minimal, you usually do a compression dressing. Give some routine analgesics and ice packs and ask them to take rest. But if it is more than 20 ml or 30 ml, it is always advisable to aspirate the synovial fluid. So we aspirate the synovial fluid using 18 gauge needle and then put a compression dressing around the knee joint and ask them to take rest for a week. So this compression will prevent further accumulation of fluid within the joint. Thus the patient will become more happy and comfortable. Another thing is this synovitis is usually recurrent. It can happen multiple times. So patients who are prone for this synovial inflammation, they should be very careful. They should not get hurt easily. If they have even a very minor injury also, there can be a lot of recurrence. So up to 3 times we can aspirate this fluid, but if there is more than 3 times episode, then these kind of people will require a small arthroscopic procedure to remove the synovial fluid. So whenever you have any kind of effusion in the joint, so effusion is nothing but swelling around the joint, which makes you uncomfortable, you find it difficult in walking or folding the knee, immediately consult your nearby orthopedic surgeon and take further treatment. Thank you.